we have our patient here, and we're doing a little bit of dry needling with her today. This particular patient is dealing with a lot of neck pain, neck tightness, headaches, things like that. And so dry needling is really perfect for a situation like this. Dry needling is similar to acupuncture. In fact, these needles that I'm using are acupuncture needles, but instead of using the acupuncture methods of tracing the energy channels through the body and things like that, we're actually just going very structure based. So we're going right into the tissues that are affected, which for her are here in the neck and the shoulder. We can do dry needling just about anywhere, but for her, we're doing here in the neck. So the needling, what we like to do with the needling is we put it right into the tissue, and then that creates two different responses. Okay, the first response is that of neurological descending inhibition. Putting the needle into the body helps send a signal to the brain to decrease the neurological signal so it starts to relax the muscles a little bit more. And then the second is that of a hormonal response. Putting the needles in, and then later I'm going to wind them up just a little bit, that creates a kind of a micro trauma, which sends a signal to the brain that, hey, we need to get some healing here. So it helps to promote the hormonal response so that your body sends healing into that area. So that's kind of the main reason that we do that. And we can do dry needling for things like headaches, chronic pain, significant tightness, all kinds of different things. And so we're, like I said, here we're just doing kind of the neck and the shoulder for this example, but it really can be done all over the body, in the back, the limbs, the shoulders, arms, wrists, even the feet, plantar fasciitis, things like that. Okay, so here, like I said, we're starting to wind these needles up. This is just, again, creating a little bit greater response around the tissue and around the needle here. This part is probably the most uncomfortable. You just feel a little bit of a burning, aching, spreading sensation, and that's how we know that we're getting the stimulus that we want, okay? And then what I'm gonna do is I'm actually gonna place these electrodes, and we're gonna place them on some of the needles, so that then we get electrical stimulation right through. The needle then becomes the electrode, and it goes right into the muscle that we're targeting, which is pretty cool. And so we're gonna get this set up, and then we'll kind of show you how it works. Okay, so now we've got it set up here. We've got these electrodes running, and we kind of do it separately. We're targeting different muscle groups, but essentially we just kind of sit here. Now we let this go for about 10 minutes, and that's a typical dry needling session. Then we'll take them out, and she's gonna go about her day. She's gonna do some exercises with us, those kinds of things. So dry needling is really great. I like to do it at the beginning of a session because we really get improved muscle tone, which is the resting tension level of the muscles. And so exercise becomes more effective after having done dry needling. Now, dry needling can be incorporated with physical therapy, especially if you're recovering from a specific thing. However, it can also just be used as kind of a one-off treatment. If you feel just extra tight or you've been through a lot of stress, we can do 1 or 2 sessions just as kind of a maintenance thing. So there are a lot of different ways, and if you have any questions about dry needling, how it works, feel free to give us a call, stop in. We'd be happy to give you a demonstration or talk to you about how this would work.